calcium therapy. Mark Manhart here. We want to talk about individual specialties in dentistry where calcium therapy fits together with them is great. And I used this word before. It's conciliant. It fits together. This is good. This is new. That's better. This is not. When does it fit together really well? And so I want to just cover several things where it's connected. Calcium is connected with oral surgery, taking teeth out, doing any kind of surgery in the mouth. When you use these calcium materials before you do the surgery, actually, it's a terrific diagnostic aid. You know, we look at x-rays and think that's the whole story. You look at an x-ray, that's got to be it. We know everything. No. Using a little calcium therapy before that surgery would really help dentists to diagnose. It's kind of double, triple checking your diagnosis, which you always want to do. Another thing that you can really work with calcium therapy is if you have a dry socket. If you've ever had a dry socket, you will never ever want to go to the dentist again. That's the way it feels. Well, you can take the calcium materials, and especially with something like these strips that you just put it in over the socket and let it help. And they're very simple. They have calcium on one side and a little design on the other side. It's a cute little design, see? It can help calm the dry socket. We don't have to put a lot of more stuff into it because it just get the calcium near there and it makes it feel better and heal faster. You might have heard the word cavitation, where you go in and dig out a socket where the tooth has been removed. No. You put a little something like this over it, or put a little calcium into that socket. Not very much. It's a few little drops. Not even a drop. That's even a lot. And calms that cavitation and stimulates the reforming of the clot without digging it out as if the only thing to do here is do surgery and dig it out. And no. You want to calm it down, change the thing. And dentists, to kind of wrap this up, dentists are really kind of, they are afraid of their own peers, you know, and they're afraid of peer pressure. Okay? Don't be afraid of that. Don't be afraid of second opinions, third opinions. They're very healthy, very knowledgeable. You get a lot out of that. Peer reviewing something is important. As long as you're looking at that from a scientific point of view, which means we are equal, and this what happens here, and this what happened, they are very likely legitimate things, whether you ever heard about it before or not. They're legitimate things that we should be positive about. Peer review. Peer review is a positive pushing forward the science. So try that. Mark Manhart here, and thanks for being with us for this kind of series. CalciumTherapy.com.